Sarah, you've been muted.
I was muted. I'm sorry. Hi, everyone. Good afternoon. This is Karadina Sale with the McSilver Institute, along with the Community Technical Assistance Center of New York State. I'm sorry, I was muted. I was talking. We're just letting everyone hop on, and we're going to get started in 1 second. We're really excited for today's webinar, a really important topic around work-related traumatic stress. So welcome to everyone that's joining, and we'll start in 1 minute. As a reminder, everyone's muted. We would love to chat with you along the way. If you have some things to say to us, there are several opportunities to chat. Julian, who is our presenter today, has put in several Let's Chat questions, so you'll chat into all panelists through the chat box. It's located on the right. There will be some resources that will be at the end of the presentation in the slide. And there will be a short survey at the end of this webinar that we do ask everyone to participate in if you can. We do pay a lot of attention to these surveys, and they do inform our future work, so we really appreciate that. As a reminder, the slides and the recording and resources will be posted on our CTAC website. And thank you for all you do, you essential workers, during this pandemic that is still going on. We really do honor you and appreciate all the work that you do. So without further ado, I'm going to pass it on to Julian Cohen-Sarens, who is talking today about making space at work, exploring secondary traumatic stress. And I just want to say that this topic is incredibly important for all of us providers in the field, and I often feel something that we don't give enough attention to. So we're really grateful for you, Julian, for presenting today. And we would love your input from the audience around your experiences and the things that you have to say. So without further ado, Julian, I'll pass it on to you. And just thank you, everyone, for being here. And thank you, Julian.
Thank you so much. So my name is Julian Cohen-Sarens, and I just want to thank everyone for being here today. It's great to be able to talk about this subject. It's something that I'm very passionate about, as you'll be able to see. And I think what we'll start with is the agenda. So we'll do a quick introduction on me and a bit about my background, kind of the goals and perspectives of the webinar. We'll define secondary trauma and try to have a good working understanding of it so we can identify it. We'll do a brief overview of the research on secondary trauma and a brief case study, and we'll end the presentation with solutions and future directions. All right, so a little bit about me. So I'm a licensed clinical social worker. I've worked in a range of roles in behavioral health, clinical and managerial. Some of the range has been outpatient settings, partial hospitals, inpatient and shelter settings. But then I shifted towards research, and I enrolled in the PhD program at New York University's Silver School of Social Work. My primary area of focus has been on workplace mental health. So it's something that I've seen in the field, that I've really sought to research, and that I can feel a lot of passion towards and want to make an impact on. So I look specifically at what we can do to prevent or reduce burnout and secondary trauma. Those are workplace conditions. All right, so what's the perspective of this webinar? What do I kind of want to get across with today's presentation? So first, I'm going to be focused on all of you. I'm going to be focused on providers, support staff, managers. This is for anybody in the field. I do take a well-being focus, and what that means is that I am going to be focused on your well-being and prioritizing that, because even though we, of course, are focused on serving our clients and doing the best we can to support them through so many difficult parts of their lives and helping them to thrive, I do believe we need to always keep an eye on the folks who are doing the caring, and it's so important. I'd say it's essential. This will be focused on the workplace, so a lot of your mental health, including in the workplace, does relate to things that are outside of the workplace too, and I recognize that, certainly. But today's webinar will be focused on the workplace. Everything I try to talk about will be based in research. I will give some of my own impressions and some experiences that I have, but trying to always convey the best research available to everyone so you can take it back to your own workplaces and hopefully it can be of some use. Hopefully it can be applied. All right, so what we'll start with is secondary trauma. What does it mean? So real quick, let's go into the chat, and if folks wouldn't mind just giving me a yes or no if they have heard of secondary trauma. Is it something that you've heard of before? Is it a brand new topic? Seeing some yeses coming in, that's fantastic. Glad to hear that. Of course, you don't have to, and anybody who hasn't heard of it, that's okay too, but I'm seeing a lot of yeses come through, and that's great. All right, so let's start with a basic definition. So this is kind of a baseline definition, and I'm going to read it aloud, but I want everyone to focus on the word transference and what that means. So secondary trauma is the transformation of a client's traumatic experiences to a clinician, causing that clinician to themselves have their own trauma reaction. So this is something that is experienced by the client, not by us as providers directly, but experienced by the client. We hear that experience and we ourselves have a trauma reaction. So this is the sort of thing that it's not something we experience directly. And that's what makes it unique. It's coming through a client experience. We're in the workplace. We have that kind of a provider hat on. And so it still has that strong traumatic reaction. A quick little note I want to make is that secondary trauma and vicarious trauma. So there is definitely some debate in the field as to whether these are distinct. So far, I would say that they have been used interchangeably in the literature and in the research. And usually they rely on this central definition. So for this presentation, we're going to use the term secondary trauma. However, when you're out in the world, if you want to look more up about this topic, you might see vicarious trauma as well. And there might even be some debate on it. But the most important takeaway is that they can be used interchangeably. They have been many times in the past. And for this particular presentation, we'll be focused on secondary trauma. We will abbreviate it often to ST. All right, so secondary trauma is definitely the focus, but we do need to take a step back. What is trauma? Trauma, of course, is a huge field. It's something that we can study in many different venues, something people devote, of course, their whole careers to, and it's tremendously important. But knowing what it is and a reminder of what it is gives us a little bit of a window into why secondary trauma is indeed a type of trauma, and it's an important trauma to pay attention to. So we can see the definition here. This is from the DSM-5. And you can see highlighted at the bottom, you have indirect exposure to adverse details of the trauma, usually in the course of professional duties. And it lists a couple types of providers that might be receiving or listening to those experiences. So that's in the official definition of what trauma is. That's an important part of what trauma is. And that is secondary trauma, that indirect exposure in the course of your professional duties. All right, so I want to turn back to the chat, and I'd like everyone to type in some words that come to mind that are associated with trauma. I'll give everyone a few seconds here. What comes to mind right away when you think of trauma? And I'm just looking over at the chat and seeing what you're all putting in. And
they're going fast. PTSD,
is,
fear, ACEs, emotional wounds.
Yeah, folks here are fantastic. Yes. So what I'm seeing, everyone, is it's dead on. Everyone here is putting in really important words that are associated with trauma, and it's because we see it so frequently. And that's a theme we'll see throughout this whole presentation. Trauma is present in our work. It's present in our mission for helping those in need. It's also present in our own personal lives, and it affects all aspects of our lives. One way to think about it is that we develop, right? We develop even in the workplace. Our development continues. And that means that something that we all kind of know quite closely, trauma. All right. So another set of questions for the chat box. I'm going to be asking some questions throughout, so I'm glad to see folks are engaged and are giving responses. So for these 3 questions, what I would ask is that you can respond to all of them, 2 of them, or just one. But what is a quick kind of definition or something that you would say is trauma? how would you name it in that kind of granular level? Give everyone a few seconds to do this as well. How would you know it when you see it? Mm-hmm. Life-altering experience, loss, yes, and yes, right. I saw hypervigilant. That's great. We'll get to that a bit later. I appreciate that. So many great responses. And again, thank you all for typing those in. So what we definitely seem to know in our webinar, which is a huge advantage, is that trauma, it is something that it is profound. It is a life-altering experience. It is something that has a huge impact in your functioning, and it can affect physically and psychologically. So to kind of parse out a bit more of what secondary trauma means, I'm going to go through two very commonly related terms that are actually quite different. I want to make clear that when folks are looking up secondary trauma, you might see these terms as well. And they're also, each of these are very important and there's more. But I want to go through them just so we can really finally understand what is secondary trauma versus these other two terms. So I'll start with shared trauma. So shared trauma is when the traumatic experience the traumatic event is experienced at the same time by the clinician or the provider and the client. So common examples of this would be the September 11th attacks, Hurricane Katrina, or even right now during the COVID-19 pandemic. So I think that the important kind of highlight and differentiating factor here is that it's experienced at the exact same time. It is not relayed to the clinician. It's something that we all have to experience together, but we're still in the workplace. We're still serving people who need our support. We're still working. And that means that we still do have to have that provider mindset, and it's difficult, and it's complex. It's a different term though. Burnout, now burnout is something that I think I could go up to anybody on the street and say, do you feel burned out? And they'd probably have an answer. They would probably have some ability to understand what burnout means. But in this specific context, and what we're talking about in today's webinar, burnout, we're going to use the specific definition, which is that it's a workplace syndrome. It includes emotional exhaustion, depersonalization, and a reduced feeling of personal accomplishment. So the key difference to highlight here between burnout and secondary trauma, and actually shared trauma too, is that burnout is caused from the work environment. It doesn't require a trauma or a particular event to make you burned out. It doesn't mean that they can't be burned out by repeated traumatic events, but it's triggered from the workplace environment, not a traumatic event. All of these are important, but we're working with secondary trauma today so we can identify it and try to address it. All right, so considering those differences, why is it important to look at secondary trauma in particular? So one, it's part of the work. It seems that everyone out there who's responded already knows that secondary trauma is something that or trauma in general, is something that we know quite well, and secondary trauma will therefore be part of what we do. So it's part of the work. It's part of what we're going to deal with every day with our clients. The other factor is, and we'll get into this, of course, quite a bit more, is that it has some serious effects. It can affect you. It can affect your interaction with coworkers, clients, your entire agency. It can have some profound effects. And most importantly, and hopefully this webinar can be a part of this, gaining knowledge on this topic will help us identify it and better address it. So I want to turn to the chat again, and I want to ask folks out there if they have any additional kind of addendums to this definition they want to type in, or if there's another subject matter that could be clarified. And if possible, if someone does have another term they would like to be clarified, if that could be brought up to me, that would be great, just so I could see it better. I see compassion fatigue. Yes, so compassion fatigue versus burnout. And those are very related terms. So compassion fatigue is specifically related to caregivers. When I say caregivers, people in the field who are providing services. Compassion fatigue is something that is more industry specific, but it can look a lot like burnout. It can be due to increased caseload, paperwork. It can be caused by workplace conditions, while burnout, not necessarily so. Burnout's been measured and studied in finance, among postal workers, in a full range of professions. Compassion fatigue, less so. Also, an interesting kind of way to see it is sometimes compassion fatigue has a kind of an opposite, which is compassion or satisfaction, or compassion satisfaction. And so that is a difference where burnout, the exact opposite of burnout, there's a little bit of debate around that. Some folks say it's engagement is the opposite of burnout. Some people disagree. So the two terms have remained distinctive, but there are tons of overlaps. And I think it's important to make sure that's clear. Thank you all. All right, so now we're going to delve into the research. Something I just want to highlight again, I am passionate about this, but I will not take you into the weeds where I go every single day looking at statistics and methods, I promise. Instead, we're going to go over research for these specific reasons. So first, research can tell us if secondary trauma is an issue beyond our immediate environment. It can tell us, is it an issue in other similar workplaces that we may not be able to see or know about? It can tell us how prevalent secondary trauma is, exactly what those effects are, and if they're similar or unique. And most importantly, if we can find some commonalities, we can work towards how to create solutions for it. All right, so the first thing you'll see here, and I apologize if this is a little bit small, but this is the secondary traumatic stress scale. This is the primary thing we're going to see if we look at research to know how strong or how prevalent secondary trauma is. And this is from the National Association of Addiction Professionals. It is actually 17 questions. I just kind of took a snippet of the first 10. And this will be attached, I believe, in the resources later. Folks can look at the entire scale if they would like. Yes, there it is. Thank you so much. And so I encourage folks to take a look at it. The reason why this can be important is when you have a scale with numbers, you can get a range of how prevalent or how strong secondary trauma is. It's concise, it's easy to cite, and we'll see. We do cite some statistics in this webinar, and it can kind of begin to show the scope of the problem. So an example of this is how common is secondary trauma? So let's give it a range. So a 2019 study shows that 13% to 29% of providers are currently experiencing secondary trauma. That is prevalent. That's a lot of folks. At the high end, that's getting towards a third of providers are experiencing this. For reference, the VA estimates about 7 to 8% of the United States has PTSD over the course of their lifetime. So even though, of course, they're talking about the entire US population, we're just talking about providers, different scales there, it still shows that by percentage, this is a common issue. And it's something that we can think of when we have crises that occur or increased workload, more clients, that this can be growing. Unless we address it, this issue will grow. So what do we know enough about? I think it's always important to highlight where the research is, and I think it's important to also highlight where the research isn't. What are some question marks that we still need to figure out? And that's because all of us in the field are going to see this with our own unique lens. We're going to see this through our work. So we don't know enough about secondary trauma across different types of provider sectors. We don't know as much about secondary trauma and racial differences or gender differences. And there hasn't been enough research on regional differences. Doesn't mean that there's been no studies on these topics, but hasn't been strong enough. And I hope that researchers, like those I work with every day, try to tackle these issues more so we can get more clarity and try to see if there's ways we can target those most in need or areas most in need. So let's think about how secondary trauma affects us. We can think about this in two ways: individually and organizationally. This is the way I often like to think about workplace issues in general. So individual factors. So when we think about one way to think about individual factors is our own emotional symptoms, our physical symptoms, cognitive symptoms. And I hope that everyone notices the little checks down here on this slide. Those look like the symptoms of trauma, right? That's because it is a type of trauma. So these are things that affect you personally. These are symptoms. And flooding, trouble sleeping, difficulty empathizing, over-empathizing, and even something very physiological like increased heart rate. These are signs of secondary trauma. I see a question came in, what is flooding? That's a really great question. So flooding is when emotions or something, kind of a triggering type of emotion, usually a tough emotion, could be sadness, it could be fear, comes over you, it's unable to really be fully controlled. And so a common side of flooding is something reminds you of the traumatic event or the experience of hearing a traumatic event, and you might begin to cry. And that's because it's a strong reaction happening from experiencing that trauma, either directly or through a client's experience. Another way to think about this is how you individually relate to your workplace. So this is still individual, but this is now you in the workplace. And I think I said earlier before, I'm going to always focus on that because I think it's important that we focus on the workplace, and that includes focusing on ourselves in the workplace. So secondary trauma, those symptoms that we just saw on the previous slide, that can affect how you interact with clients, coworkers, your agency, and even outside of your work. I think that it also relates to something called moral injury. And this is a term that is a little bit harder to find research on, but it's there, I promise. Moral injury is when the work seems morally compromising or so difficult morally that you don't feel like it's an okay thing to do anymore. You're not doing any good. Maybe even you're doing harm from the work you're doing. And a traumatic event can certainly trigger moral injury. Now, another way to see this is organizational factors. So organizational factors of secondary trauma, the way an organization might see this. Now, the way to understand my perspective here, this is now the organization looking at an individual with secondary trauma. So they might notice a difference in the quality of their work. That they're maybe not getting work done precisely or accurately to help their clients in the best way they can. It can affect organizational culture. And I want to quickly define that. So organizational culture is it's the environment and the norms, the dynamics of your workplace. So it can relate to being welcomed in your workplace, having a sense of community, feeling that your workplace is just and fair. Organizational culture is extremely important. It's something that there's plenty of literature on, but I found in my experience often is ignored in behavioral healthcare in general. It's not paid enough attention to, but it's extremely important because we work together and no one's an island. So organizational culture is incredibly important, and if you experience a shared traumatic event or a secondary traumatic event, it could affect organizational culture, and that also relates to safety. I think safety in the workplace, that means speaking up about how you're feeling too. That could mean you've had a very difficult experience seeing a client, secondary trauma has occurred, and you need to tell your supervisor. If there isn't safety in the workplace, you might not feel comfortable doing that. It might feel like weakness, or it might feel like showing a vulnerability. You don't trust the place that you work. And having that sense of organizational safety is incredibly important and can be violated by secondary trauma. So if we get even more macro and we look at now the organization, maybe several organizations or sectors looking at effects of secondary trauma, we get to these bigger issues. Absenteeism, so taking a lot of days off because you're just not able to get yourself to work that day. Turnover, you're leaving your job completely, and that can be very difficult for your team that you work with, for your clients, and for the organization. Rehiring a new person and training them, getting them up to speed, that takes a lot of work, and turnover is a serious issue in our field. Also, decrease in morale and engagement. So that's feeling like you're ready to give your best work, that you're feeling like you're thriving in your workplace. So I want to go back to everyone out there, and I'd like to know what are some other ways secondary trauma might affect you? And also, what's your hunch? I always like to ask this question. Is the research accurately portraying the issue? I'll give everyone a couple seconds to respond to this because I think it's always interesting to hear about what your perspectives are on the research presented and other new ideas that I have not thought of. So I'll turn over to the chat now. While they're coming in, I'll take a quick sip of water. Mm-hmm. Definitely.
Some people are saying calling out of work, that ST may look like calling out of work. not wanting to show up,
I think
affecting one's personal life and professional life.
Yeah, and I think that
leaving the field, leaving the field altogether. A few people said that. That's fascinating. Yes, absolutely.
I think these are really great answers. Thanks, everyone. This is a great audience today. This is fantastic. Yes, and I think that when we yeah, these answers coming in are great. Sorry, but really, when we think about calling out of work, I want to make a quick little note on this. If somebody needs a day to take off to heal and recover, that's not really what we're referring to. I mean, when somebody calls out repeatedly because they're not getting the support they need. I think that that is very important. And I saw a couple of folks that said the research is accurate. That's great, and I hope that we can make it more and more accurate over time. All right, so let's jump into some risk factors for secondary trauma. So what can put you at risk for secondary trauma? So when we say risk, we have the definition of secondary trauma, exposure to a client's trauma while in the workplace. But what I kind of want to emphasize a bit more is what can put you at more risk considering that definition. So one way to look at it is the number of exposures to a client's trauma. So that means that, like, let's say you're someone who works exclusively with folks who've experienced trauma. That means it's going to happen quite a bit. You're going to be exposed to people telling you about really difficult situations they've been through. And the more that happens, the more likely it is that one of those deeply affects you as well in a way that's beyond kind of what we would normally have, and it might cause a traumatic reaction. It might become secondary trauma. I think the other way to see it is the intensity of those exposures. So that means sometimes certain fields are there for folks who might have a bit more intense traumatic experiences. And it's important to be there for these folks. This by no means is saying we shouldn't approach these issues. We should just approach them and be more prepared, learn more about them, and know that taking care of ourselves and taking care of ourselves as providers in our workplaces means that we can actually serve these folks who need it so badly. But I want to kind of focus on those two areas as what can kind of regulate or moderate exposure to secondary trauma. It can make it more prevalent or common. All right, so we're going to go back to everyone again. Have you ever worked with a client who had experienced a traumatic event in their lives and shared it with you? And this can be a yes or no. I'm going to look over at the box, and I'm seeing a lot of yeses. I have to say, I am not surprised at all. I would be shocked if I saw a lot of no's. And that goes back to a common theme throughout that I want everyone to take with them, if they take anything out of this, it's that this is going to happen. Traumatic events occur, and our clients are going to need support if they bring it to us. So this will happen. It seems like it has happened for everyone. Here's kind of a next kind of one step further question. Have you ever been able to not been able to shake off hearing about a client's traumatic experience? This is also could be a yes or no question. Seeing a couple yeses, a few no's. Right. Some folks are saying, been able to take a couple of days off and feel better. That's great. One person out there said, especially with children, that's really important. Yeah, I think that certain fields do experience difficult traumatic cases more than others, but everyone does experience it in the field. And so if anyone said yes to any of these questions, it means that there is an ability to develop a secondary traumatic reaction, to experience secondary trauma. So let's look at the research again and look at what have been some ranges of secondary trauma. So one UK study in 2011, this was done in the United Kingdom, they have a National Health Service, and that's where this came from, suggested that about 47% of therapists, again, only looking at therapists here, psychotherapists, were exposed to trauma from clients. So that's the low. That's the lowest range I was able to find. And that's about half. Another study, and this was in the United States, said that it's about 86.5% of clinicians, so that goes beyond just psychotherapists, it includes other types of providers, are exposed to such trauma. So that's getting towards 90%. If we think about how prevalent that means this is not an issue we can ignore. If the low is half of us, about half of us, a little less than half of us, and the high is getting towards 90%, and that's just reported cases, that's just really from a particular study, um, it certainly is a prevalent issue that we do need to consider. So I want to emphasize, I italicized the word some in this slide. These are some occupations that have been linked to a higher risk for secondary trauma. It does not mean this is the only one. It does not mean that if what you do isn't on this list, you're at a lower risk. I basically just couldn't list all of the occupations, or it would be the entire slide deck. All you'd be looking at is a list of occupations. Wouldn't be that helpful. So you can see that a lot of folks who respond to emergencies, a lot of folks who work with sexual assault, children, acute care, um, I think that it could be crisis counselors. So it's a huge range of providers. All right, so I want to turn to everyone with a couple questions. So what are some other risk factors you might be able to think of that could lead to secondary trauma? And why do you think these factors are so prominent? Give everyone a few seconds to respond to this as well. And if possible, if someone could let me know some answers that folks are giving, just because I think a lot of folks are in the chat, and that's fantastic, but can't quite read them quick enough.
A lot of personal trauma histories are coming into the chat, as well as the news, lack of vacation time, PTSD, lack of vacation and sick time.
Yes.
Peers being traumatized.
Mm-hmm.
Lack of self-care.
Definitely. So, I mean, these are great answers. I think that these are all areas we will touch upon. Having support and resources is really important for being able to address secondary trauma when it occurs. It definitely is prominent, and I appreciate everyone sending so much in. It's great to see. So we're going to jump now into a quick example of secondary trauma. And what I'd like to let everyone know is that this is going to go through it's not a real experience. It's not taken from anyone's life or in any way identifying of anybody. This is just kind of loosely based on experiences I've heard of. But I'd like to just give a bit of a warning to everyone that this could be difficult to read, and it can definitely be a bit triggering. But I do think it's important for us to just get an example, something illustrative that we can look at as saying, well, what could cause secondary trauma and what could it look like? Again, this is just for clarity of example. And in the next slide, I'll have folks kind of read through and then respond to a couple questions. So we're going to call it the case of Steve. Just chose a name. And the setting is a community health center. The situation, it's 9:30 in the morning, it's midwinter, and Steve is the intake coordinator during a clinic's walk-in hours. All right, go into the situation now. So I'll give folks a few minutes, or I'll give folks just a minute to kind of glance over it and read this through. And in the meantime, I will take a quick sip of water while folks do, and then there'll be some questions. Yeah, I definitely think I can kind of run through it if that would be all right for everyone, for folks who might want to hear it and be able to kind of take it from that from of a auditory perspective. I'm also an auditory learner, by the way. So, all right. So the situation is a 24-year-old Latinx man presents to the community mental health center to enroll in mental health services, primary care, and a referral to a shelter. The intake coordinator, Steve, is tasked with learning more about his needs and providing necessary referrals and diagnostic information. During the intake interview, Steve learns of profound sexual abuse and that the client has recently survived from his partner, including physical violence, financial abuse, and persistent stalking. Steve listens empathetically to the client's situation, provides excellent referrals and services. But after the intake, Steve is unlikely to see where the client ends up and how the situation is resolved. This is the first and last time Steve will see this client. During the days after the intake, Steve notices that they are unable to sleep, unable to stop thinking about the graphic details of the client's experiences. Steve starts frequently looking around the building where they work, suspecting that the client's partner may be waiting to intercept the client. During staff meetings, Steve finds themselves that their coworkers who they used to have good relationships with now irritates them, and that they start snapping at them, something that Steve never used to do. When Steve has new intake sessions, they find themselves uninterested in those new clients' experiences and notice that they're doing as little as possible to support them, just kind of scraping by. Steve starts to wonder why they're in this field at all and starts questioning if they ever really helped any of their clients and considers leaving the field completely. So that's the situation. I know that is tough. I'm going to go off that slide now for folks who maybe didn't want to go through, listen to that. And that's totally fine, of course. So now I have some questions that I would like some answers from the audience, of course. And you can answer one, two, all of them, whatever is most comfortable for you. So what do you think will happen if Steve does not receive support? What would you recommend that Steve do? And what did this example bring up for you? I'll look over at the chat to see some stuff coming in. And thanks again, everyone, for your responses. Right. I'm seeing a lot of folks talking about saying that Steve needs to talk to someone, talk with colleagues. I'm worried for Steve, his ability to bounce back. Yeah. Maybe Steve sees a therapist outside of work, definitely. Yeah, and I know this is the right audience. I know that folks out here, if you met with Steve, I know that everyone out here would be supportive and would have some resources to provide for Steve, for them. Yeah, and so I think what everyone's touching on, and this is the important point to highlight, is that Steve does need support. Steve does need to have an ability to reach out to a supervisor or a coworker, kind of make folks aware that this was extremely difficult for them and that they're going to need support to get through this. It's not something we can do by ourselves. And I know that for folks, this can be very relatable. This is happening again. This is prevalent. This is common. This is in the work we do. All right, so that was the example. That's the end of the example. I want to do a quick check-in with everyone. Can folks out there type in one of these answers? How are we feeling? Fantastic, good, okay, getting a little tired, not so great, none of the above, or where am I? I see a where am I, that's impressive because that means you're kind of here. So you answered the question. I'm seeing a lot of responses. Thanks, everyone. All right. It is getting towards the 2 o'clock snooze. I appreciate you guys sticking with me. It's great. All right, so we're going to jump into the next section here, which is solutions and future direction. So this is the last section of our presentation today. And what I want to start with is, what are protective factors and what does that mean in the context of secondary trauma? So we look at individual factors. These are things that you come into work with. Your financial situation, your housing situation, education. There's a whole list that I didn't include, but who you are matters. Those can add or subtract protective factors to secondary trauma. Demographic factors. The fact is structural racism, patriarchy, these factors do affect secondary trauma because they affect us and who we are. It's part of who we are. We can't pretend we're like, I guess, blank slates or that kind of ultimate neutrality that I don't really subscribe to personally. I think that we come into the work we do with tons of lived experience, and we do need to be aware of that. And I think that it needs to be honored in the workplace as well, but I'm getting ahead of myself. Individual social networks, I think those are very important. Who do you have to talk to? Who supports you? Who doesn't support you? This will matter when secondary trauma or a traumatic event occurs. Your own work experiences, maybe you come from a place that was very supportive and you can kind of bring that with you to your new place of work, or maybe the opposite, which I've seen very frequently, where someone comes in and they're a new employee and they've had no support whatsoever. And so there's a lot of kind of unaddressed traumatic experiences that these providers have had to live through without any support. And of course, coping skills, knowledge. Hopefully this presentation will give folks some knowledge to start to build coping skills and learn more about what they can do. Now we're going to go to organizational factors. So what are some things from the organizational perspective that can be protective against secondary trauma? So strong supervision, of course. Leadership needs to be involved and engaged. Benefits, and the folks have already talked about that in the chat, so I really appreciate that. And policies and procedures. So now we're going to jump to the solutions end of things. So we think about solutions. What I'm saying here is these are things that you can do on an individual level to be preventative or help you mitigate the effects of secondary trauma. Because everyone here is in the field or soon to be in the field, this applies to anybody. Anybody who's looking to be in a behavioral or medical-based field, these are things you can do. But what I would then, I'll kind of get into some of the listing here. So mindfulness activities are really popular. These are things like meditation. There's actually practices called mindful eating, which is kind of, I guess I'll provide resources at the end. I have a whole listing of mindfulness resources folks can look at. Taking breaks, that means actually taking a break, changing scenery, taking a walk. I know that COVID has affected our ability to do some of these things, but this is just a list. Being honest with folks who are supervisors or management about how you're doing. And then also, we did have some questions about resources before. So I do want to kind of give those a moment. EAP means Employee Assistance Program. Not every workplace has one of these, but this is the workplace pays for a certain amount of therapy sessions for you, or sometimes it even applies to you and your family. Taking advantage of that would be great. It gives you a free and confidential space to engage in therapy, and maybe they can provide referrals if needed, or they can do at least some supportive counseling. Supervision, when I say additional supervision, I mean supervision that actually focuses on shared traumatic or secondary traumatic events. HR benefits like time off, I think those are fantastic. And for some folks, looking into union resources is not frequently mentioned, but I do think that it's something that we can look into. Sometimes unions provide training to learn more about how to deal with secondary trauma. I'm going to get on my soapbox for just a second, everyone. Individual level solutions, they're beautiful and they do work. There's both science that shows that and they work in my own personal life. I am not against individual solutions. However, they're not the whole picture. We would never tell somebody to deal with their own trauma by themselves alone in isolation. The fact is, we need community, we need support, and the workplace is a community. It's an organization. And if we're dealing with this completely by ourselves, that isn't fair, that isn't right. We can't be expected to just resolve issues by ourselves on our own in the workplace. It's not a complete picture. It's definitely an important part, and I encourage everyone to look into those individual supports they can do for themselves to make themselves stronger, to build that type of resilience, but it is not the complete picture. And I think that if you're being told this is all there is, hopefully this webinar can allow a response that no, there is a bit more that organizations can do. And so that's where we're going to kind of go into now. So we talked about supervision, policies and procedures. So I'll get a little more specific. So this means having a response plan for a traumatic event. asking your workplace, do they have procedures or resources or debriefing meetings or a place we can go in the case of secondary trauma? Who do we talk to, and how is that going to work? How can we make our workplace safer and more open to being able to talk about these things? These are things that do need to happen on the policy level. They need to be larger scale within your workplace. But that also includes reasonable caseloads, trying to encourage teamwork in our workplaces. The fact is, again, isolation in the workplace is never good, just as isolation outside the workplace is never good. And I think I've said this maybe a few times, promoting psychological safety, feel safe, talking about these issues and actually working through them in your workplace. That needs to come from the workplace. That's not on you to establish by yourself. I put in promoting learning, and I think that relates to psychological safety. So that means knowing that mistakes can happen. We're not going to handle everything perfectly. We need to be in a workplace that understands that, expects that, and is ready for that. And that means that it means compassion. It means understanding people are where they are and trying to work with our providers, our coworkers, or those we supervise. But also it means making a commitment from the organization to provide resources and ways to improve our workplace conditions. There is, of course, some drawbacks to organizational level solutions. I don't want to say this is like obviously the golden bullet, or I think people would have known that by now. It is complicated. Organizational level solutions do require buy-in. They require folks to be on board because it's the whole organization acting together. They often require folks in leadership to be early adopters of these changes. And that means that advocacy is needed, and that's easier said than done. I know that with the caseloads we have now, or the caseloads in general, it can be hard to also make room to be a workplace advocate. And that's a lot to put on yourselves. So it's not easy. I don't think it's going to happen overnight. And there's a reason organizational level solutions are a little less studied and a little less in practice. They're a little less common in general, but I still think they're important. We do need to take them into account a bit more. All right, poll question for everybody. Individual level solutions, organizational level solutions, neither, or a combination. What do you all think would work best to address secondary trauma? You can give the letter or you can give the response. I'm seeing a lot of some combination of both. It's a great answer. Yes. There's a, feel free to respond to the poll question. It'll give us a little percentage. That's always fun to see. I won't see who responded to what. So you can say whatever you feel. But at the very least, I'd like folks to remain aware that there are both types of solutions. All right, and I think the poll is still up, but whenever it is ready, I'll be able to let everyone know, or maybe they'll be able to see what the results of the poll are. So folks out there, my team could let me know when those results are in, that'll be great. Looks like it should be coming in just a second, the results. Polls are fun. I usually like a poll on a webinar when I'm listening in too. All right, so it looks like most of us said some combination of both. And I appreciate everyone saying that, because the thing is, both are in the workplace. We are individuals in the workplace, but we are not alone in the workplace. We're not isolated in our workplace. Both exist, just like in any other part of our life. There's community and individual, and we affect each other simultaneously. There's a give and a take. So these are great answers. Thanks, folks, for responding to the poll. All right, so what are some other organizational, individual level solutions that you can think of? And has your workplace already promoted any of them? I'd love to hear about what's happening in the field for all of you. Are there certain things that you'd like to bring into the chat that has worked or hasn't worked? If I could have a couple responses brought up, maybe just two, that would be great. Thank you. I'm seeing significant supervision, flexible scheduling, groups and art projects. I like that a lot. I think, expressing, when we talk about trauma, and this is deviating a little from today's subject, but expressing trauma comes in different ways. It's not always verbal for everybody. It can be done in different venues of communication. That means art, dance, music, and that can mean a lot. So I appreciate that. Wellness days, yes. Yeah, those matter. Those matter a lot. Staff appreciation days, these are great. These are things that we do need, and and even though they might be lacking, these are things that are often, I mean, just to be a little bit cold for a second, some of these can be low cost. You can make the case for these in the workplace if you're in a position to, of course, and you feel comfortable and safe doing so, and they can be implemented. I've seen it happen. Thanks for your responses, everybody. All right, and so what we're going to end with is some future goals. So this is what I kind of hope folks can take away from today's webinar. I know that this is a topic that wasn't really new to folks, but maybe has some nuances and things that you can kind of take from this to bring back to your workplace, or at least broaden your own awareness of this really important issue. So recognizing that secondary trauma is part of the work we do, that we need to create supportive and adaptive workplaces. We can't ignore the issue or exacerbate the issue. We need to prioritize well-being before it occurs if possible. We need to commit organizationally resources and time to prepare for when this occurs. We need to be empowered to speak up and express our needs in the workplace, because the workplace is an environment we develop in. We spend tons of time every day at work. We can't pretend that we are going into it and we're not ourselves. I know we put on the professional hat, and that's great, it can be protective, and it's also just part of what we do. It's how we're trained, but it doesn't mean that we are blank slates. We come into the work who we are. And then, of course, advocating for those secondary trauma protections and policies. I mean, it's something that I think the future needs. It is something that does take a degree of safety, and I understand that not everyone's going to be in a place to do that. But for folks that are, I encourage you to do so. It'll help you and your entire networks of workplaces, not just your own workplace. It can spread. It can become the norm, and it can empower workers all over. So for some last additional resources, so the APA has a list of self-care strategies. These are simple things you can adapt to your daily life. They can be very small, take maybe 2 or 3 seconds, or they can be larger scale. Routines or exercise that take several minutes, to even like meditation apps or supports. I want to also plug Adam Grant. He is an organizational psychologist at University of Pennsylvania's Wharton School. It's a business school, actually, but his TED Talk is about work life. It's about kind of the organizational elements of work and how it intersects with our mental health. So if folks like a podcast and they want to listen a bit more about how these issues manifest all over the workplace, this won't be just targeted to providers, but it's very interesting. I listen to it quite a bit. And if folks would like an example of an organizational approach to trauma in the workplace, one thing that came to mind that I just think I could share for folks is it's called the sanctuary model. It's just one, there are many, but this is developed by Sandra Bloom, who is at Drexel University in Philadelphia School of Public Health. And it requires some training, it requires some buy-in from your organization, but you can look through it on the website and just see how it manifests, how it's developed. And I'm glad this will also be posted for everyone. So thank you all so much for joining me today. I know the work you're all doing is incredible. It's incredibly difficult at times, but you're saving lives. I know it because I've been there, and I know it because I see it every day in my community and all over, even in the media. I see it everywhere. So I just want to thank you all for taking some time today to listen to this and to go through these issues with me. I hope that everyone can get something from this webinar, and really thank you again, and happy Thursday to everyone. I'm going to hand it back off to Kara now.
Thank you so much, Julian. That was amazing. Everybody's really appreciative of you sharing your expertise with us. So we do have a few questions, and we're going to just ask you a few questions in the last 5 minutes that we have, if that's okay.
Of course, yeah.
Great. Somebody's asking, is a secondary trauma defined in the DSM?
So secondary trauma is not named in the DSM to my knowledge. The definition of trauma includes what secondary trauma is. So in other words, experiencing it indirectly through the workplace. So I would say that if you were, I think maybe this question could lead to, I'm just extrapolating, but could you be in therapy and be diagnosed with secondary trauma? To my knowledge, that hasn't been done. I don't think that that's impossible. I don't think that's something the future couldn't hold pretty easily. The case is so easy to be made because it's in the definition in the DSM. But I do think that at the moment, not so much. What I will say is that the WHO, they may have their own kind of classifications of mental health issues, and they include a lot of workplace. They include burnout. They might also be a venue to include secondary trauma.
Great, thank you so much. Somebody along those lines was asking, is there a duration of time that people typically have symptoms that you mentioned to be considered secondary trauma, or do just having the symptoms mean secondary trauma?
That's a great question. I think that would need to be developed a bit further in research. But I can say from what I've seen so far out there in the literature, it occurs in a similar sequence to exposure to a traumatic event that leads to post-traumatic stress disorder. So there needs to be intrusion, which means that it's affecting you beyond your time with that client, that it has symptoms that are reoccurring. And I think most importantly, it takes the approach that it needs to be interfering in areas that it maybe wasn't interfering before, though that weren't an issue for you before. So in terms of a set timeline, I don't think I could provide a set timeline of within X number of days. In my experience in the field, it's been pretty quick. So it's been folks who maybe have done a session with a client, and maybe just in the coming minutes or hours after, they start to feel pretty shaken, and it doesn't subside very quickly, and more support is needed. But again, it's a great question. It's something that I think research does need to answer more definitely, like we have with other types of trauma.
Yeah, agreed. Thank you. Along those lines, has there been any talk of what the current projected numbers of secondary trauma experiences might be like during COVID, speaking of your definition of shared trauma and symptoms?
It's another great question. It's something that I'm definitely wondering about and actually working on right now. It's tough. So because of the way of what COVID is, COVID fits better with a shared trauma definition because it's occurring globally. It's occurring everywhere. It's not directly related to a client telling you about an event. So let's say you're in a therapy session and your client says to you, this has been my experience in COVID. Even though that is being relayed to you in the client in that setting, COVID's also hitting you as a clinician in your life outside of work at the same time. So it fits better into that definition of shared trauma. And I think because of that, the research on it's been a bit different, but there's no doubt it's going to elevate the occurrences of shared trauma and secondary trauma and burnout. The fact is that one thing we've learned from the COVID-19 pandemic is that support for providers is not something to think about on the back burner. It's not something that we just kind of put away and address when there's quote unquote time, which there, of course, there never is. It's something we need to devote immediate attention to, because even though this particular pandemic, will not last forever, there will be other large-scale events we need to prepare for. And it also needs to be part of the DNA of organizations to think about the well-being of their workforce more than just some secondary need. I know our priorities are clients, and I know that's why we get into the field, but we have to take care of ourselves too, and that means organizational and individual responses.
Thank you. Awesome. Just real quick, one more question. I know it's 2 o'clock, everyone, but this question is so important. What is an activity that can be offered in supervision to be a protective factor around preventing secondary trauma experiences? That's
a great question. That's awesome. I think that, so there's a bit of a give and a take there, and I'll speak a little quickly because I know we're at 2 o'clock. One, supervisors need to be trained to be aware of secondary trauma, so to ask the question and create a safe space in the supervision session for you to bring that up. So again, that's one, and I think the primary direction. The organization needs to come to you. If that's not possible, if you're not in a circumstance like that, having this language and this knowledge can allow it to be brought up in a supervision session. I would bring it up quite overtly. This experience occurred in a session, and it's really been affecting me. I have not been able to sleep well. I'm kind of experiencing my own traumatic experience from this. What can I do? And I think that, let's say the supervisor says, well, I don't know what to do. That means more education is needed on the subject. I would ask that supervisor to delve into the literature and maybe the organization as a whole to do a training for supervisors.
So more training and more speaking up and
Yes.
creating that a community of support around you. Fantastic. Love it. Thank you so much, Julian. We really appreciate your time with us today, and we really appreciate everyone's participation today. You all were amazing, so communicative, and we just really appreciate it. These are our upcoming events. Assessment, overview, and best practices. We have a two-parter coming up, connecting with caregivers, supporting parents of children with serious mental health concerns. Another two-parter happening in May. Hope to see you all then. Have a wonderful rest of your day, and take good care, everyone. Bye-bye.